Hello and welcome everybody from across the world joining us live on Facebook for our very first show, Pulse by Health Job Hub. My name is Prashanthi Naidu, founder of healthjobhub.com. I started Pulse to connect with all you amazing people, share incredible stories, and to be inspired. My mission is to unveil the pulse behind the pulse. Today is a very special day. Not only is it the launch of Pulse, it is also International Women's Day. I wish to take this opportunity to remember the plight of women and children living in all parts of the world having to face abuse, oppression, slavery on a daily basis. It is also important to remember the people like Dr. Fozia Alvi who are courageous and are speaking out against the violence and oppression. Thank you, Dr. Alvi, for all the incredible work you are doing to stand up for women's rights. A huge shout out to all the amazing women in my life, especially my mom. I love you. Pulse by Health Job Hub is a live talk show. So if you have any questions, please ask. If you are watching the show after the fact on another social media platform, please ask away. We will answer the questions. If you enjoy our show, please smash the like button and share with your network. I'd like to thank our sponsor, Health Job Hub, for sponsoring this show. Find your dream job in healthcare on healthjobhub.com. Our special guest today, live on Pulse, is Dr. Fozia Alvi. Dr. Fozia Alvi grew up in Pakistan. She is an American-trained physician who's working in Calgary, Alberta for the past 13 years. Her and her husband, Tahir Alvi, were always passionate humanitarians and had organized several health and education-related projects in developing nations, including opening a charity-based maternity hospital in rural Pakistan. She went on for a medical mission to Bangladesh refugees camp in 2017 and was moved by the plight of Rohingya and has since been an advocate for them. She spoke at various levels, international levels, about this genocide and is also involved in the advocacy for the Uyghurs of China and putting a stop to illegal organ harvesting. She currently runs her foundation, Humanity Auxilium, and organizes medical relief missions. She has been given various awards for her advocacy work, including being nominated for the Nobel Prize in 2019. Dr. Fozia Alvi is a mother of 3 children, chair of Airdrie Community Physician Association, and chair of Highland PCA. It is indeed my privilege and honor to welcome you, Dr. Alvi, to our show this morning. Thank you for joining us.
You're welcome, and thank you for inviting me here. It's an honor to be here and talk to your audience about International Women's Day.
Oh, thank you so much. And I do see we have some audience who are clicking onto our chat. That's amazing. If there's any questions, please ask. We will try and get to you. I must say it was not an easy task to distill 5 to 8 questions to ask a special guest such as yourself, who has so many incredible and inspiring stories to share. But I will try my best. Please share your story about what inspired you to pursue a career in medicine and become a family physician.
I grew up in Pakistan, and Pakistan is a poor developing country. I had seen lots of trauma and misery due to the lack of proper health infrastructure. So that really kicked me to go into medicine because I wanted to be a doctor to serve people.
Yeah.
And now the work that I'm doing besides a physician, the advocacy work, I have seen growing up in Pakistan, the fall of Soviet Union, and I saw that how the war and all these crises, they affect normal people. So that's pushing me to do the advocacy work also now.
Oh, wow. That's very inspiring. You are now deeply involved in doing a lot of humanitarian work and also the founder of and CEO of Humanity Auxilium, an international NGO. What drives you to do all this incredible humanitarian work?
I always had lots of passion to go and serve the most poor and vulnerable people who cannot pay me back.
Mm-hmm.
And I have lots of respect for organizations like Doctors Without Borders.
Yeah.
But I had young children, and as a young physician, I could not leave for a longer period of time to go overseas and do these medical missions. So in 2017, when I heard about the plight of Rohingya, so I decided to go there and help them. In my first medical mission in Bangladesh back in 2017, the hopelessness and the trauma that I witnessed in the Rohingya women, especially, and children, it inspired me to do work more, and I decided to raise my voice. I thought that I won't be able to look at myself in the mirror if I don't do anything to help these women. So that's kind of motivates me to do work more, because I started this work in 2017.
Yeah.
But those people, those Rohingya people, they are still there in those tents.
Yeah.
So I have to keep fighting until they are back in their houses.
Yes, absolutely. Can you share any specific story about those Rohingya people? Because I know you've told me some of the very tragic stories that you encountered with like young girls and women and the abuse they are facing in those camps. Could you share any of that?
I have lots, countless stories, because I saw hundreds of women over there, and I met dozens of women who had endured rape and torture. One story that I always tell about a small girl. One day on my first mission, I was coming back from the medical clinic, and I stopped in a tent, and there were two women inside. They started telling us their story. So one woman was telling us that how she was sitting in her house, and the Myanmar military came to her house, and they snatched her baby from her lap, and they threw baby to the bonfire in front of her.
Oh my goodness. My goodness.
And how they slit her husband's throat.
Oh my
and
goodness.
Afterwards, she was taken to a barn, and she was raped for 15 days.
Oh my God.
It was too much for me to handle. And while I was hearing that horrible, horrible story, I noticed a small girl sitting on the back in dark crying. So she was hearing how her baby brother was killed alive in the fire, how her mom was raped. And
oh my goodness.
She was the same age as my daughter Iman.
Yeah.
I looked at her and I thought that, how this girl is going to survive in these refugee camps.
Absolutely.
Her mother who had endured rape. And so the eyes of that young girl, and she was crying quietly, her tears, they were telling me the stories of injustice and trauma.
Yes.
And that she's facing.
Yeah.
So after coming back from a medical mission for months, I couldn't sleep because I kept on thinking about that girl, and I said I have to do something to help those women. So this kind of, I think I still can remember very well, very vivid picture of her. And I will never forget that young girl.
Oh my goodness, and neither would I. Gosh, that story is so moving, and I just don't know how, I can't even comprehend how people are treated like that in those parts of the world. Gosh, it's so sad. And, thank you for stepping up, and thank you for doing what you are doing, because you are making a difference. Nobel Prize 2019 nominee. Wow. Please share.
I hate to talk about that, actually, because I always say that it's not me. It's not me. It's about those poor people that I advocate for, and I work for them. And those poor people, we must not forget them, because they are still living in those tents in garbage condition, in subhuman conditions, with absolutely no hope. So we must not forget those people. So I always tell that when somebody asked me about the Nobel Prize nomination, I always tell them that it's not about me. It's about those poor people that I work for. So you must not forget them.
Absolutely. What do you consider to be your most important role, and how do you balance being a mom, a family doctor, a humanitarian, a Nobel Prize nominee, and the founder and CEO of an international NGO?
It's not easy, I must admit, and I wrestle with it every day. I always say to my friends that are only 24 hours in a day, but the credit goes to my amazing husband, Tahir, as well as my children, who have endured all of my PTSD after my first mission back in 2017. And my husband, his sport, he's amazing. He always encourages me to do more of this work. And he always makes sure that when I go to these medical missions, my house is well taken care of. He takes care of my children very well. And my children who have seen me, in the past 3-4 years, and my trauma and my work. So they are the one who recharges my battery.
Oh, that's wonderful. Yeah, it's so important to have a good support system around you. And you are very fortunate to have a wonderful family. So thank you for sharing that. In creating Pulse, one of our goals is to have our finger on the pulse. With that in mind, with today being International Women's Day, what is one piece of advice you will give women and girls listening to this show?
I always say that it's our shared responsibility to help to those who do not have privilege, because access to education, safety, and healthcare is the basic human rights of every human life. Unless our world is deciding what they are going to do about these refugees, it's our shared responsibility to work for them. Happy International Women's Day to all of the audience. It's not only for those women and girls, it's to everyone whose life is going to be changed when our world is more fair, when we will give justice to everyone. I think the conflict, racism, climate change, all are these driving forces for fear, displacement that we are facing to this unprecedented level. It doesn't need to be this way. Solution exists. I think all of us, we have a role to play. It's our shared responsibility to work more for them. In the past few years, we have seen that there is a wave of nationalism and far right in the world. That's why it's very important, and I cannot stress more than that it's very important to account for those people, like Myanmar government, for the Rohingya refugees, to hold those people accountable for their crimes. Because if we don't do this, then we keep on seeing this kind of behavior to be repeated. As we have seen last year in 2019, in India, for example, what happened in Kashmir, what happened just a few days ago in New Delhi, that innocent people were killed. So if we don't discourage this kind of behavior, then we will see the rise of these far-right forces in the world. And it doesn't need to be this way. So we have to stop it. As of recently, there's a there's a case going on against Myanmar government in the International Criminal Court. But Myanmar government says that that case is very misleading, and if the crime did happen, then it needs to be dealt in their criminal justice system. Basically letting the bank robbers to be in charge of their investigation.
Right.
So we have to raise our voice. We have to do something. And I think all of us, including all the audience who are listening. It's very important to recognize that all of us, we have a role to play.
Absolutely, 100%. And I'm sure everybody listening is inspired by those stories that you are sharing with us. And, together we can definitely make a difference. Physicians in Alberta are currently up in arms about the looming pay cuts on April 1st. Please share your views on this radical and unpopular decision by Alberta government to cut physician pay.
It's sort of the hot topic these days, but in the past few weeks. I don't want to be a critical or anything, blame my government. I love my province. I'm proud to be Albertan. Recently, I think lots of my colleagues are very discouraged because they feel disrespected by their government. Because all of us, we feel that we were not consulted properly by our government to make these changes in our healthcare.
Yes.
So as of recently, I'm in a conference in Banff now, Alberta College of Family Physician Conference, their annual meeting. And I've heard that I think the negotiations are going to be restarted this week with Alberta Medical Association and between the government and the Alberta Medical Association. So this is a positive thing.
Absolutely.
I hope I'll keep my fingers crossed that, it's going to be good for us and for our patients, because ultimately it's our patients who are going to suffer.
Absolutely. Yes, that's true. Well, I'm wishing you luck with that. Please, keep us posted. I hope there's going to be a positive change in that respect. With regard to the widespread global epidemic of COVID-19, also known as coronavirus, what is your medical advice for all of us afraid of this virus exploding in Canada and around the world?
I'm glad that you asked, because there's a lot of panic, especially in the last 2-3 days in Alberta, especially where we are living, because there are 2 cases have been diagnosed. I think people are getting panic a lot. Simple things that I will encourage people: go back to the simple hand washing with simple soap and water. That's the best thing. And the hand washing, I will advise them to do it at least for 20 seconds. And hand sanitizers are good, but I will encourage, when soap and water is available, to wash their hands for that. And if you have traveled outside the country within the last 2 weeks, and if you are sick, please don't go and visit your family doctor's clinic or the emergencies. Call Helping 811. If you're very sick, then just call 911 and get the medical advice or go to the emergency. But do not leave the house, self-isolate yourself for 2 weeks' time. And then get medical advice by calling HealthLink 811.
That is great advice. Thank you so much. Thank you, Dr. Alvi, for joining us live on Facebook this morning. I know you have an extremely busy schedule ahead of you today. Please share with us, what's your day going to look like today?
So we are wrapping up our annual Family Medicine Summit by Alberta College of Family Physicians. I'm part of their planning committee. So I'm doing a wrap-up session. It's a medical conference. I spoke to my team yesterday, my planning committee team, that, it happened to be the International Women's Day today. And it's a coincidence that I'm wrapping up the session at noontime today. So do you guys mind if I speak about International Women's Day and women's rights, because I wanted to bring a flavor of humanity to our medical conference. So all of my medical colleagues, they were very supportive, and they encouraged me to speak about it. So I'm going to speak about it, women's rights, and what we have to do, especially as professionals, as to strengthen other women.
Oh, that is wonderful. Gosh, I'm really honored that you made time in your busy schedule to join us on Pulse. Thank you so much for being here with us. You inspired us greatly. Thank you. And thank you for all the work you're doing. It's absolutely amazing. This brings us to a close of our very first Facebook Live show for Pulse by healthjobhub. I do hope you enjoyed the show as much as I did. Please join me next week, same time on Facebook Live. I am so excited to announce that our special guest joining us next week is Dr. Arnold Chetty, qualified optometrist and qualified and practicing medical doctor MBA, and founder and CEO of Proudly Irish. Please join me again next week to be inspired on Pulse by Health Job Hub. And please don't forget, if you enjoyed the show, smash the like button and share it with your network. Thank you.